Good day, everyone. I am Ronald, moderator for this webinar. I welcome everyone for today's webinar that will be on care of the LGBTQI patients and their families, policies, procedures, practice, and laws. I would now like to introduce our presenter for today, that is Susan Strauss. Dr. Susan Strauss, RN and doctorate, is a national and international speaker, trainer, and consultant on workplaces and healthcare violence and a recognized expert on workplace and school harassment and bullying. Susan has a doctorate in organizational leadership. She is a registered nurse with a bachelor's degree in psychology and counseling, a master's degree in community health, and a professional certificate in training and development. I would now like to hand over the floor to the speaker. Over to you, Susan.
Thank you, Richard. Greetings, everybody from Minnesota, and welcome to summer. Today's webinar is going to be drawing on issues that are becoming, more of an issue in healthcare. So with that, let's get going. There's just my bio, and let's look at today's objectives. 1, we're going to list the relevant laws, the regulations, and the standards that are required for health equity and patient-centered care of LGBTQI patients. We will identify the key policies, procedures, and practice issues that are related to LGBTQI patients and their families, to incorporate some already existing policies and practices. We'll discuss some opportunities to collect LGBTQI data and information during the healthcare encounters. We'll identify or revise strategic community outreach efforts for this population, and then we'll list a variety of resources. All right, so let's get going. One thing is that, well, it's not just healthcare professionals, but all of us, we assume heterosexism of our colleagues and our patients. That's just an assumption that we make. We don't assume that they might be bi or lesbian or gay or trans. We just assume that they're like us, if the us is cisgender. And it's important for all of us to respect whatever languages that are specific to the LGBTQI community and what those variations might mean, what those preferences might mean. It's representative of people for whom that word is a representation of their identity. LGBT is lesbian, gay, bisexual, and transgender, also seen as GLBT, and keep in mind that it's inclusive of all backgrounds. Lesbian, I'm assuming that you know what lesbian is. Females that are sexually and emotionally attracted to other females. Then we've got gay. So gay is referring now to males that are attracted sexually and emotionally to some other males. Some people are still using the word gay to apply to both males and females, but it might depend on the context of the conversation. And then we have bisexual, people who are attracted sexually and emotionally to both males and females. Now let's look at a little bit more of the terminology. Now let's look at transgender and transsexual. Transsexual is an outdated word, though. Just be aware of that, and it's not used. And the people that are in the transgender community don't like that word to be used for them. Now, it used to be that you would use the whole term, transgender, transgender male, transgender female. Q stands for queer or questioning. Intersex is referring to an individual who was born and their genitalia is hard to discern whether it is male or female. A stands for ally or androgyny. There's a number of other A's. I would hope that those of you that are not within the LGBTQI plus community are in fact their allies. Then gender nonconforming. Sometimes that is said as gender queer. And then there is non-binary. It means you really are not identifying with being male or female. And then gender expression. How do you all, based on what you identify with, and then there's gender identity. Do you identify as being male? Do you identify as being female? Do you identify as being non-conforming or binary? Now let's look at some of these individually. Queer, to them now it's a unifying term. It's a socio-political term. Now, questioning is what else Q means. Now, think about what that might mean. You'd be questioning your gender. You'd be questioning your sexual identity and your sexual orientation. It's a sensitive issue. So those who are using a different gender that does not match the sex that was assigned to them at birth is what a transgender individual is. Cisgender is referring to those whose sex assigned at birth matches their gender identity. And transsexual is an older term. It's not used now. We do say trans person. That is not an umbrella term for everyone. We all have an orientation and we all have a gender identity. And in the middle is bisexual, sexual orientation. And what does sexual preference denote? It denotes that this person has a choice. So the difference then between gender expression and gender identity is gender expression is our physical display of how we communicate our gender within our culture. Then there's gender identity. Now this one is more of a concept. It's how we feel deep within ourselves. Explains the gender identity and expression, orientation, and biological sex. Now this is something that kind of puts it all together and showing assigned at birth, comparing it to gender identity or sexual orientation, comparing it to gender expression. So what is heterosexism? And it's a system where anything dealing with homophobia or anybody that displays something that's not heterosexual, when we talk about heterosexism, it is a systemic display of homophobia in our institutions, our laws, and our policies. So here are some examples of heterosexual privilege. They have the right to job security and freedom. So who is an ally? What does an ally do? And we need allies in healthcare. It's someone who doesn't identify as, but supports LGBTQI social movements and speaks out for inclusion. So we need to acknowledge that as a community, of course they have their own culture. These are some of the things that actually should be explored. So we look at transgender. All of these are discriminatory against the LGBTQI community. So let's take a look at gender expression laws, where a separate protection may exist under disability discrimination, and that is called gender dysphoria. So what about stereotypes and cliches when you are marketing and then to accurately depict female to male individuals and masculine women and drag kings? Now, let's look at LGBT health disparities. The higher risk of mental health, such as anxiety and depression. So there are these tremendous outcomes that are not favorable towards this community. What these organizations, how are they viewing it? And they are missing the boat. Of course, there's a common theme. Transgender patients far exceed their negative behavior from healthcare professionals. Almost 27% of transgender were actually refused care. Now, here were healthcare professionals that refused to touch me. And here now we're back to transgender patients being the brunt of harsh or abusive language. And those that were treated roughly or abusive by health professionals living with HIV, they were getting blamed. Okay, we don't always think about older people. I guess I would fall into that as an old baby boomer. We don't always think about them being LGBTQI. Let's take a look. So they're not feeling welcomed there. And here they are, little old people. I hate to say that because now I constitute as a little old people. Stuck between a rock and a hard place. LGBTQI folks were not allowed to have visits from people that were within their community. So what are the barriers? Well, there are barriers. And there are people that think, I'm just not going to talk to anybody that I think falls into this community. Now, the Joint Commission, they have gotten involved in this. So this is what they suggest. Use this aggregate level of data dealing with orientation and identity. These are questions that need to be asked and answered. Now, here are some questions recommended that you put in every new patient's chart. Okay, what laws and standards apply? So these are the laws and standards generally that the Joint Commission has established. Now, here are the laws and standards. The complaints that were filed is going to be following through on any complaints, whether it's for discrimination and harassment or anything going on under the healthcare umbrella. Now, here are the laws and standards. Take a look at them. So 504 of the Rehab Act, and then the American Disabilities Act, and then you've got EMTALA, and then the Hill-Burton Act, and then you've got the Affordable Care Act, and Title IX, and then you've got Title VI of the Civil Rights Act, and that's dealing with people of color. And then there's HIPAA. So let's look at this EMTALA. So any hospital that participates in Medicare, all the individuals that come there are protected here. Now here's the Hill-Burton Act. So if your healthcare organization receives funds from Hill-Burton, and it's my understanding that most do, that you would be covered. And what this says is that your organization has to be available to everybody who resides in the territorial area. The policy that you would have must ensure that services are available to those in the service area. You cannot discriminate. Now, here is HIPAA. It is 1557, and this was established under Title I of ACA. Now, here's Title IX. Title IX also protects people from being, if you sex stereotype them, same-sex harassment. Now, here's the Civil Rights Act of 1964. So that is dealing with those that don't speak English well. All right, what about the ADA? So your policies must be in compliance with these acts. Now, you've also got HIPAA. Now, it might be a voluntary compliance until you have somebody raising the stink with the EEOC. Now, we know that Medicare and Medicaid plays a role as well. Play any role in saying who may or may not visit a patient based on their orientation or identity. Now, the Centers for Medicare and Medicaid, they have to consider also your unique discharge planning needs for older and disabled LGBTQI patients. Now, there is a national data progression plan for LGBT data collection and any other demographic data. So even though it says sex, It doesn't say sexual orientation or gender identity, but it says any other demographic data. Now there's a health equality index that you might want to be a part of. So it can be used as an organizational assessment. And this is what it focuses on. You, as the employer, have to demonstrate your responsibility to the community. And if you don't engage in action, then you are undermining their equality. And you can use it to educate patients. You can use it to educate staff. Now, here are just examples of education topics that you can use. And these are just examples. And think about the code of ethics for the ANA. Now, remember I talked about patient-centered care and what that means, and you know what it means, I'm sure, and we've made progress as a result, not only for your organization, but for all of your employees and for all of your patients. So different goals depending upon the area. Here's how do you use data collection and the checklist. Here's one for the engagement. So much of this has already been done. They have a glossary of terms and checklists. Here's a glossary of terms. There's so much more now that you can use that are online. Here are some organizations, more resources. Okay, I want to thank all of you for joining us today. This can be a challenging but very rewarding aspect of patient care and of whatever your culture is in your organization. So again, thank you. I hope we see you for another webinar. And in the meantime, take care, be safe, and have a good rest of the week. Thank you for joining us. Thank you too, Richard. I appreciate it.
Thank you, Susan. That concludes the session for today. Thank you everyone for participating. You may all disconnect now and have a great day ahead. Thank you very much.